Hey guys, okay, so this is video number 3. We're gonna move forward to what we do for our assessments, right? So now we have our new admission. We've already done the med rec. We've done the admission med rec. We have gotten the ancillary orders and, a medication order from the physician. So we are going to move into now what? So you want to work off your MAR. I've been saying this since we started this HCS. You want to work off the MAR because it is the easiest way to make sure that you hit everything you need to do. You guys are well aware now, anything that's due is going to be in green right here, and you just go through the system. So I do have to verify these in order to be able to sign them off. Again, these are assessments, so we don't need to worry about the duplication of verifying with the nurse. So I'm going to go ahead and do those. I know the units are crazy and chaotic, and I'm going to do this patient education one as well. Okay, but you really need to put these orders in and you need to complete this. So it will, if you don't have a chance to finish it on your shift, okay, make sure you pass it on to the nurse coming in after you, and then make sure that it gets completed. We have to complete a lot of this within certain time frames per Joint Commission and CMS standards. We're usually really good about the admission being done within 8 hours, but we're really failing on treatment plans. So as a whole, treatment plans are something that we're struggling with. You guys are doing a great job with the crisis care profile plan. I see that in the charts every day, but I'm not seeing treatment plans. Okay, so I'm going to show you guys how to knock these out. I'm going to do a separate video on treatment plans specifically. So first things first, build a treatment plan for a patient. Don't check it if you haven't done it. Crisis care plan. You click on the green, and it's going to bring up something for you. It's going to tell you date and time, preferred pronouns. My patient's a male. When I assessed my patient on the unit, he said he's going to tell me what triggers him, what are some of his warning signs, some of his coping skills. So he doesn't like loud noises and disappointment. He maybe might sleep more and rock back and forth. Maybe he likes to be alone, shower, cold face, washcloth, things that don't help him, being ignored, feeling disrespected. You want to get your patient to sign. So you hit sign. If you have the tablet, you would do this on the tablet. So you would actually have to start this on the tablet, and you can go and just turn the tablet around and have them sign. We have signature pads on the units. So if you're using a computer, all of them have at least one that has a signature pad. If you're using that computer to do your assessment, then you would hand him the signature pad out. If you guys have seen them, it's small, like the size of your phone. Hand it to the patient and let them scribble their name on there, and we can go from there. So the patient would scribble their name. The name will populate here, and you will say use signature. Other options, cottage F, maybe our dementia patients can't sign, maybe someone's agitated on C2, refuse to sign, unable to sign. Verbal consent, maybe the patient doesn't want to sign, but they're okay, and they're like, yeah, just sign it for me. So there's a couple options there. So I'm going to go ahead and say use signature, and it was signed, and then you as the nurse need to e-sign. So e-sign, everything looks good. I'm going to sign it, and now it shows that I have done my crisis care safety plan. So when I do audits every day, I come in here to items, to documentation, and it shows that it was completed and which nurse completed it. So you guys are doing a good job with this. I do see this done often on the patients, so not really too worried about that one. We're going to go ahead and fill out our consent. It's flu season. I'm going to document that we completed this and hit okay. That's done. When you actually give the medication, the consent will populate, and you have to actually put in, left shoulder, right shoulder, whatever shoulder you gave it to them. Initial nursing assessment. I'm going to come back to that one. Next is the initial treatment plan for nursing. Really quick and simple. I'm going to check this. This is the page 1 of the treatment plan that we used to do. So my patient came in 10/13, probably going to be here about 7 days, recent for admission. This auto populates from intake. So if intake did their nursing assessment, which cottage A and B and F are the only units that we really struggle with intake doing their assessment first, only because those patients go to the unit instead of waiting in intake, it will populate. So it'll put in here whatever it is that the clinician wrote. So reason for assessment, I'm just gonna put SI with plan. Oops. All right, increased aggression towards spouse, plan to shoot self. Any medical problems identified, I'm going to say that he has hypertension. What am I deferring? Nothing. You do have to fill something in, so just put NA, none, not, you know, if you want to type out not applicable. Plan is to return home. You know, if you know that your patient came from a group home or from an assisted living, the plan would be to return to placement. Medical problems identified at admission, that's going to play a key factor later when we're doing those treatment plans. Okay, so if we can defer stuff, defer it, that's fine. But you know, some things we can't: hypertension, diabetes, fall risk, seizures, those should all be identified right here. Had to be completed within 12 hours of admission. This one's hit and miss. Some nurses got this and some don't. Takes 2 seconds to do. Like I said, this auto populates, so you don't even have to wait, spend time doing that piece. You're gonna hit save. Oh, my nurse's signature. So of course, e-sign. Staff is a nurse. Your name should populate here. So, oh, select the signer. You should not have to select a signer. It should pick you up. But this is a test patient. So use my signature. Okay, so now it's signed in and I'm going to hit save. Done. I have finished my initial treatment plan. The next one is a patient unit orientation checklist. Again, check it. What this is saying is they know where their room is. We've gone over showers. You know, this is kind of what the MHT does with the patient when they first get here, going over, you know, the different rules of the unit, phone times, expectations, and then belongings. All you're doing is checking that this orientation was completed. If something wasn't completed, then you don't check it. Tour of the unit, maybe we don't really do a tour. Explain the process for belongings, sure. Again, have the patient sign. You can use their signature. Again, the same options as far as refused or unable to sign. And then I'm gonna e-sign, and then I'm gonna hit complete, and it's done, okay? So the next one that you guys will have is build the treatment plan for the patient. This just is gonna check off that you did it. So don't check it off if you didn't do it, okay? I am going to do the treatment plan, so I'm going to sign it off, and I'm going to show you guys how to do a treatment plan in the next video. The next one that we're going to do is the initial nursing assessment. You guys are all doing a really good job with this. The only thing I see is you're not saving it. So there's a lot of documentation that says partial save by an RN. You need to save your stuff before you leave. If you're here the next day, make sure you're checking that icon and signing everything off. So for my initial assessment, you know, a lot of this auto populates. You guys have seen it. Again, if intake has done the assessment, a lot of it will be pulled in. So, you know, your precautions, he's moderate. We go through and we explain everything. We'll put in the blood pressures pool, your safety check. You guys should be doing a body check when the patient gets to the floor. Yes, you can document who did the safety search and intake, but you should still be doing a body check when your patient hits the floor. So this should be your name or your MHT's names, because we're double checking that we got everything. There's no contraband, and then we've marked up all of our stuff. So safety check performed by, I'm just gonna pick, you know, who did the safety check, and then by now we should know the anatomical person. We can view it, and it'll pull the one from intake. If they did this, it'll pull one from intake. If it doesn't, you know, let's say we found something else, maybe they missed that the patient has an extra tattoo, you know, on their hip. You just click on the different letters and you put them there, okay? And then you just hit save, and now we've marked that my patient has a tattoo right there. Any abnormalities, you know, make sure everything is filled in. Again, a lot of this auto populates. Since we have the home med list now live, it will auto-populate in here too. So you can do it before you put your orders in from the table of contents, and you can also do it from here. So I can hit on-demand query and it'll pull stuff in, or I can just say, oh, let me add my home meds. My patient said that they were on Haldol at home, so I'm gonna go ahead and add it here because I didn't do it, you know, the other way. So there's two different ways you can do the home med list. You can do it from the table of contents, or you can go ahead and do it from here. I added it there, I said, okay, and now it's on there. So now, you know, if he says I'm on other meds, you could add them all here. Your admission med rec also lets you do it from here. So it's your choice, whatever is easier for you guys. You can do it first from the table of contents. You can see the first HCS guide video that I did to see how to do it there, and you can do it from here. So from here, the doctor did continue it. So I'm gonna hit continue because we know he's gonna be on this medication, and then I'm gonna keep on moving to my next slide. And then so on and so forth, alcohol, you know, education. You know, when you get to the bottom, go to the next one, and it's, you know, you pick what applies to your patient. Please make sure you're picking a device if necessary. I'm going to go all the way through. If your patient scores on the fall risk over 90, you need to do a fall treatment plan, and you need to make sure the Edmondson fall risk assessment is in there. Part of Cottage F's, most of Cottage F's patients, this is lacking. They're on fall risk, but we don't do Edmondson, or we don't do the fall treatment plan. So very important that we're making sure that we add those orders in if we need them. Review of systems, you know, whatever we find, pain assessment. Some of you have seen this open. If you hit yes, it opens up and gives you more things to identify. Again, now we need to do a pain treatment plan. Patient doesn't have any pain, hit no, keep on moving. Psychiatric assessment, how their patient doing, do they contract for safety? You know, our nutritional screening is different. Linda Warringer is no longer with the company. We have Becky now, and she actually has access to HCS, and she gets any consults that you put in. So everything is easy for you. You can do it from here. Prior to admission, my patient had a regular diet. Does anything apply? We can say that he has maybe some signs of malnutrition, and we do want to go ahead and order a BMI for my patient. So I'm going to hit yes here, and it gives you the option to go ahead and put it in while we're here. So those are all our ancillary orders that we put. I'm going to add my order, and you can just start typing dietary consult. We want to do once a day until complete. Because we want to make sure that the patient gets it. 9 a.m. Why do we want to do it? Let's say increased weight or whatever. You can also check other and put, you know, maybe they're missing a lot of teeth. They're on some new medication. They've lost weight. I mean, whatever the reason is why we're ordering a dietary consult, you could put it. If it's not one of these, you can hit other and do this, and then press OK. I'm sorry. Press OK. Now they have an order. That's going to get printed in dietary. So when she logs in, she's going to have this waiting for her on her status board. You don't need to call that number anymore. That doesn't exist. Again, we want to move away from all the old ways we used to do things. Okay. My order is already in there. I don't have to double back. Hit next. Now I'm on education, whatever, you know, whatever applies, whatever we talk to the patient about, and then just a summary. Quick note, you know, this is a 63-year-old male admitted for SI, no thoughts of harming himself currently, you know, has a history of hypertension and diabetes, or, you know, whatever the case may be, and then you're going to sign it. Our LPNs are doing really good. They know that they have to route it to a nurse first, and then they can sign it. You as the RN can go ahead and go in and sign. It's not going to let me sign because I didn't fill everything in. So I'm just going to hit partial save. And then I press OK that this was done. And now all my green has been completed. And I have done everything for my admission that needed to be done. If I didn't do it, then it would transfer over to the next unit, to the next shift. You would click on your gray button and you would put, if it wasn't done, you would click on it and complete here and say not administered or performed. Do not let it just go red. It doesn't carry over, and we want to eliminate all of the red from our nursing status boards. Put that it was not administered and not done. Why? Patient refused. Maybe the patient didn't get to the unit till really late in the shift. You can say patient was asleep, unable to assess, or whatever the case may be, whatever your other reason for not doing it, and hit okay. So it still signs it off as you didn't complete it, but it still needs to be completed, which means the next nurse will get it on her time slot right here that it needs to be done. What I'm seeing is a lot of people are just ignoring it and letting it turn red, and then we just have red for like 4 or 5 days on something that wasn't done. And so what happens is, myself or whoever else, we have to go all the way back every single day until we find which one is red and why it's red. It doesn't tell you what is missing. It just shows you that something is missing. So please, 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 if you're not doing something for whatever reason, please make sure you're still signing it off and you're putting a reason why, so that it can be continued on the next nurse's because I think it's every 4 hours. So it'll pop up again in 4 hours as being due, and then that nurse will hopefully catch it, and so on and so forth. Okay, but we really want to make sure we knock this stuff out at admission. Once it's done, you see here it's going to be discontinued, and then you continue on with the rest of your things. That's it. That's how you do an admission, ancillary orders, assessments. You guys are doing really good on this. We are missing treatment plans. So my next video is going to be on treatment plan specific items, okay? Let me know again if there's anything specific you want to see.